Introduction to upper limb, development of upper limb bud develops by the end of 4th week. Lower limb bud will develop by beginning of 5th week. Muscles of upper limb and lower limb are developed by myotome of somites, paraxial mesoderm. Bones of Bones of upper limb and lower limb are developed by somatic layer of lateral mesoderm. A rotation upper limb bud rotates 90-degree laterally, lower limb bud rotates 90-degree medially, extensor compartment anteriorly, and flexor compartment posteriorly. Okay, I can understand. Extensor compartment anteriorly and flexor compartment posteriorly. Dermatome of upper limb, tip of shoulder, that is your C4 dermatome, phrenic nerve bulk. Phrenic nerve is derived from C3, C4, C5. Phrenic nerve irritation, shoulder tip referred pain. Lateral part of arm supplied. This is lateral part of arm supplied by the C5. Lateral part of forearm including thumb supplied by C6, middle 3 fingers supplied by C7, medial side of the forearm supplied by the C8, medial aspect of arm and forearm supplied by T1. So this is the image beautifully shows you C3, C4, C5, and you have the T1. Okay. And C8 here, C6 over here, C6 and you also see 7 supplying the middle 3 fingers dermatomes in the upper limb anterior aspect, and C3, C4, C5, T2 for the medial side of the arm, and T1 for the arm, the forearm, C8 over here, medial side. The pinky finger is supplied by C8, C7 for the middle 3 fingers, and here comes your C6. So yeah, moving on to the next part. Clavicle is also called as your collarbone. It's a modified long bone. 2 ends. It has an acromial end and a sternal end. Acromial end articulates with acromion process of the scapula. Sternal end articulates with sternum, 2 joints, acromioclavicular joint and sternoclavicular joint. Acromioclavicular joint, plain type of synovial joint. Sternoclavicular joint, saddle type of synovial joint. Saddle, yes for S. And here you can remember something like APJ Abdul Kalam. Yes. So, medial aspect, sternal extremity. So superior surface that they are shown here, and anterior margin. This is the anterior margin. Posterior margin. This is the acromia, the extremity which connects with the acromion process of your scapula. It is called as modified long bone because horizontally placed, and it's membranous. It has membranous ossification, subcutaneously placed. No medullary, just by palpation you can feel the bone. No medullary cavity is present. Okay. And ligaments transmitting weight from upper limb to axial skeleton, from upper limb to scapula. Upper limb to scapula, you have the shoulder joint ligaments, glenohumeral ligaments, coracohumeral ligaments. From scapula to clavicle, you have acromioclavicular ligament, acromioclavicular joint, acromioclavicular ligament, coracoclavicular ligament. Coracoid process, you have it. Okay, so yes, from upper limb to scapula, from scapula to clavicle, shoulder joint ligaments, glenohumeral ligaments, coracohumeral ligaments. From clavicle to sternum, sternoclavicular joints, sternoclavicular ligaments, costoclavicular ligaments. And then weight is transmitted to the other clavicle by interclavicular ligaments which does not transmit weight from upper limb to axial ligament is coracoacromial ligament. Weight is transmitted to the other clavicle by interclavicular ligaments. Ligaments which does not transmit weight from upper limb to axial ligament is coracoacromial ligament. Superior acromioclavicular acromion. See a clavicle. Coracoclavicular ligament is seen here. It's the superior border. Coracoid process lies here. Coracohumeral. Okay, so this is your humerus. This is the head of the humerus. Here you have the coracoid process, like somewhere over here. I think this is your coracoid process. Coracohumeral ligament, capsular ligament, neck of scapula. This is your scapula. The superior border of your scapula, superior acromioclavicular joint, and greater tubercle. This is your greater tubercle. This is tendon of biceps. This is anatomical neck. Lesser tubercle lies here. What do you have over here? Coracoacromial ligament. This one. Okay, so can we move on to the next part? So what is the applied anatomy here? So the most common site of clavicular fracture is junction of medial 2/3 and lateral 1/3. Medial 2/3 is round and lateral 1/3 is flat. So that's why there is a change in configuration and the shape and the texture. So this area is more prone for fractures. Lateral 1/3 and medial 2/3. Okay, so thank you so much.